I am not dressed for this, but we're not talking about that today. Welcome to Derm 1. When we talk about dermatology and skin disorders, there's really a kind of host of terms that we just have to add into our skin vocabulary. So that's what we're going to start with today. See how when you're looking at my hand, you can't see all of the vasculature in there? If skin layers start to atrophy, as they commonly do in older individuals, the loss of those skin layers reveals vasculature. Any kind of large red patch around the body that's flat to the surface can be called erythema. Erythema should be able to blanch because all of the blood is contained within capillaries and arterioles and venules. By blanching, I mean push on the site and be able to push the blood out of the area. Contrast that from a bruise, which is where blood leaks out of blood vessels and blanching doesn't happen. You can push down on a bruise and you can't push the blood out of the way. A bulla is a large blister, and in a couple minutes we'll talk about blistering disorders pemphigus and bullous pemphigoid. I've always thought of excoriations as scratch marks. A crust is a crust, as the name implies. A fissure is a special kind of skin crack, and typically people get it in areas that are already prone to dry skin. As the skin starts to dry out, it loses some of its elasticity or stretchiness, and the break in the skin, the fissure, actually forms in a natural crevice. Feet are notorious for this. When people injure themselves and scar tissue develops and collagen is deposited at the site of injury, in some individuals, hyperplasia of the healing process occurs, and that excess collagen buildup is called a keloid. Contrast macules with nodules and papules. By definition, anything that is macular or is a macule is flat. Nodules and papules are raised from the general surface of the skin. A plaque is something most commonly seen in disease called psoriasis, which we'll talk about in a few minutes. The silvery top to the plaque refers to excess keratin production. Purpura has another name to it, ecchymosis. Both of these are medical terms for bruising. And contrast this with erythema, wherein with erythema we said you could blanch the area and reduce the redness by pushing blood out of the capillaries. For purpura, that's not the case. You can push down on that area of the skin, but you don't whiten that area of the skin because the blood's no longer in a blood vessel. The blood vessels have burst and the blood is in the tissue. Telangiectasias are simply capillary dilation close to the surface where you can see them. And matter of fact, you've probably seen this on someone already. And nephis is just the medical term for a mole, a collection of melanocytes. And you've seen this probably on yourself or other people. Urticaria is kind of a special dermatologic term because it indicates two things: papules plus macules. Oftentimes, clinicians will refer to this as a maculopapular rash. Seborrheic dermatitis is a condition whereby excess sebum production, typically around the face, the scalp, the armpits, produces a reaction locally, and the skin gets red and irritated, and you can see the results of it in the picture here. Who gets this? We don't really know, but it's probably an interaction between folks with the right genetic predisposition within the right type of environment. Shingles is caused by human herpes virus 3, also known as varicella zoster. Because its refuge is within neurons, when the virus reactivates, the distribution is typically within a dermatome or a map of a neuron within the body. Look at some of these pictures here and see if you can correlate them to different dermatomes. And then there's ringworm. Ringworm is not a worm at all. It's a fungi, specifically dermatophytes, small organisms that feed off of keratin in our skin. I'm getting kind of itchy. Why am I getting itchy? Based on where the fungal infection is, the name will change, but it always starts with tinea. Tinea corporis, tinea pedis, tinea cruris, tinea capitis, tinea onychomycosis. Scabies are very tiny arachnids that are typically spread person to person and burrow under the skin to lay eggs. I'm getting kind of itchy. Why am I getting itchy? Occasionally, the area of the burrow itself inflames, and this makes diagnosing scabies and separating it from other skin conditions a whole heck of a lot easier. Another distinguishing feature of scabies is the ridiculously itchy status of it. Intensely pruritic means very, very itchy. Psoriasis is a common skin condition whereby epidermal tissue is overproduced, and in so doing, you get this hyperkeratinized look to certain areas of the body afflicted with the psoriasis. These areas are called plaques, and as you look at the picture, you can kind of see why. Now, though psoriasis is connected to immune dysregulation, it's not technically an autoimmune disease. Your autoimmune diseases involve antibody production to certain tissues, and psoriasis is not associated with that.